Namaskar dosto, good evening friends. I am Dr. Sanjay Kalra, your friendly and familiar endocrinologist. You are watching Dr. KK's MEDtalks, Mondays with Dr. Sanjay Kalra. आज के हमारे नॉन स्टॉप शो का 831वां 831st एपिसोड है. Let's have the headlines for today. There's been a big boost for the Ayush market, and more than 590 crore rupees of trade interest has been generated at the first SCO, that is Shanghai Cooperation Organization, Conference on Traditional Medicine. तो ये कॉन्फ्रेंस हुई ट्रेडिशनल मेडिसिन पे, और जो हमारे इंडियन सिस्टम्स हैं आयुष, इनमें बहुत इंटरेस्ट और दिलचस्पी दिखाई दी. Prime Minister Modi has said that medical seats in India have doubled over the past few years. That's true. और अब ज़्यादा आसान होता जा रहा है for aspiring doctors to get a seat of their choice. A report from Practo has revealed that there is a surge for oncology, इसका मतलब cancer, and mental health consultations in women in 2022. तो कैंसर और मेंटल हेल्थ वाली बीमारियां बढ़ती जा रही हैं. मगर कैंसर और मेंटल हेल्थ को इकट्ठा कैसे लेते हैं? One disease is breast cancer, and a study reveals that still there is a lot of fear, the fear of being a burden and the fear of being a social stigma, which prevents women from seeking help for breast cancer in the early stages. तो मेरे ख्याल इसको भी हमें एड्रेस करना चाहिए. And new research has shown that intake of vitamin D helps in preventing dementia. और इसी के साथ आज का टॉपिक देखते हैं क्या है. आज का हमारा टॉपिक है विटामिन डी, द कार्डियोमेटाबॉलिक बूस्टर. तो एक्चुअली खुद भी जब मैं विटामिन डी लेता हूँ तो एक्चुअली एक बूस्ट मिलता है मुझे, एक मस्कुलोस्केलेटल फिजिकल हेल्थ वाला बूस्ट, मगर कार्डियोमेटाबॉलिक बूस्ट भी होता है. तो इसके बारे में देखते हैं, जानते हैं. लेट्स इनवाइट आवर गेस्ट. एक्चुअली गेस्ट क्या है, हमारे केके मेडटॉक्स के फैमिली मेंबर है, डॉक्टर सुनीत कुमार वर्मा. वार्म वेलकम डॉक्टर साहब.
थैंक यू सर. गुड इवनिंग ऑल. गुड इवनिंग सर.
डॉक्टर सुनीत हमारे गेस्ट भी रह चुके हैं, हमारे होस्ट भी रह चुके हैं केके मेडटॉक्स पे, तो इसलिए इन्हें फैमिली मेंबर कहना ही सबसे दुरुस्त होगा. ही इज वन ऑफ द मोस्ट फिजिशियंस इन ट्राई सिटी चंडीगढ़. Multitude of accolades to his credit, and he works not only in chronic disease like diabetes, hypertension, asthma, but also in acute infections, dengue, malaria. तो इन दोनों को भी देखते हैं इकट्ठे के acute illness और chronic illness में दोनों में विटामिन डी का क्या रोल है. तो डॉक्टर सुनीत, आज का हमारा टॉपिक है विटामिन डी कार्डियो मेटाबॉलिक बूस्टर. पर ये करेक्ट है क्या, जो लोग चंडीगढ़ में रहते हैं, चंडीगढ़ वाले आदि बैटरी चार्ज रहती है 24 घंटे, इज दैट राइट?
सर डिपेंड करता है. चंडीगढ़ वालों की बैटरी तो चार्ज ही रहती है, बट क्यों चार्ज रहती है वो डिफरेंट मैटर है.
वो डिफरेंट मैटर है. तो विटामिन डी का रोल देखते हैं उसमें. अगर हम अपनी बैटरी चार्ज करना चाहें 24 घंटे जैसे गाने में बताया जाता है, तो देन व्हाट इज द रोल ऑफ विटामिन डी? सो वार्म वेलकम डॉक्टर साहब वंस अगेन, एंड द स्टेज इज योर्स.
थैंक यू सर. सर विटामिन डी का काफी अच्छा रोल रहता है फॉर एज ए बूस्टर, एनर्जी बूस्टर भी हम कह सकते हैं, बिकॉज व्हेन वी फील वेरी फटीग, व्हेन वी आर लेग्स आर क्रैम्पिंग, वी हैव लाइक क्रैम्प्स आर देयर. So, उस situation में then we found that if somebody is deficient in vitamin D and if give them vitamin D supplementation, there's a marked improvement in symptoms. Patient or person actually feels very healthy, very energetic, and very like he is willing to work more. So this is the magic of vitamin D. Anybody who is coming to our OPDs and saying that I am डॉक्टर साहब मुझसे तो चला भी नहीं जाता, मेरी टांगें दुख रही हैं, मेरी पिंडलियों में बहुत दर्द है, and you find in that he is an office goer who hardly or barely see any sunlight, and for past 2 years or 3 years he has not seen sun. He goes early in the morning at 8 o'clock and comes back by 7 or 8 in evening. So in all probabilities, and he is vegetarian, he is not living in an area where you can find a seafood, or he is not taking non-veg. In all probabilities, we are dealing with vitamin D deficiency. And vitamin D deficiency can lead to all these symptoms he is telling us. So what we do is, ideally, we should go for a vitamin D level and check for his vitamin D deficiency level, how much is deficient, and give him supplement. If we are sitting in a resource limited areas, even then, if we give a vitamin D supplementation, maybe 60,000 units in a week, for 8 weeks to 12 weeks, then things will improve definitely. Where there is a very less chances of hypervitaminosis D actually. There is now a chances of hypervitaminosis C where I do live, जिनकी बैटरी थोड़ी ज़्यादा चार्ज रहती है, वो ज़्यादा विटामिन डी खा चुके होते हैं. Actually वो भी थोड़ा देखना ज़रूरी है in our resource full settings rather than resource limited settings. So ये अक्सर हम देखते हैं. If we move on to our topic, we can we should move for our slide. Let me just give me a moment. Just a second, sir. I'm just finding some difficulties in sharing my screen. Let me share it.
It's fine. Of course, the first song that came to mind was Battery Charger in the 24 Ghante. The other one is Chandigarh Kare Ashki. And it seems that low vitamin D status has also been associated with impaired semen quality. So, for men with subfertility, again, it would be a good idea to have what we call nutritional optimization as a general rule of thumb. Nutritional optimization in impaired sperm quality would mean, first of all, adequate macronutrients, that is, proteins especially. Secondly, avoid obesity overweight because obesity is associated with increased aromatase enzyme, and then that leads to increased production of estrogen, which can suppress fertility as well as sexuality. And then the third is micronutrients. So first, macronutrients like proteins. Then secondly, avoiding obesity. And third is ensuring adequate micronutrients, the vitamins and minerals. Uh, an example of a mineral would be zinc with regards to spermatogenesis. And the most important vitamin would be vitamin D. So these kind of songs, Chandigarh Kare Ashki and all this stuff, I wonder why all these songs are made on Chandigarh only and they're not made on Karnal, for example. Uh, for Kanal, we do have one song that is by Badshah, but it's a very straightforward kind of a song. And he says, "I'm from Haryana, I'm from Karnal, and that's it, and we have arrived." So that's the kind of song process that we have here for our part of the state. There are many aspects to vitamin D. In the last episode, 2 weeks ago, we discussed the musculoskeletal aspects of vitamin D, and Dr. Nitin Kupu spoke about them. But apart from musculoskeletal, there are other advantages of vitamin D. Uh, Metabolic is what we'll be talking about today. You also have mitogenic effects. Mitogenic, for example, vitamin D is used as adjuvant therapy in some cancers. Uh, it can be used to help manage psoriasis. Vitamin D is also useful in miasma. Miasma means infections, and Dr. Suneet is the right expert actually for this. So, when you're struggling with severe COVID, when you're struggling with asthma, frequent acute exacerbations of asthma or COPD or respiratory infections, does vitamin D have a role? So we'll carry on. Dr. Sunit, we were speaking about various M's: musculoskeletal, metabolic, mitogenic, miasmic. Shall we share the slides for you, or will you go ahead?
Sir, begin sharing. And sir,
Yeah.
having some technical issues, I think. So we were Dr. Nitin Kapoor and Sanjay sir had discussed about vitamin D in the last show, and that was awesome. And we have discussed many things. Now, to be on a very specific side, let's discuss something about cardiometabolic aspect of vitamin D. So, what does this cardiometabolic aspect of vitamin D is, and how does vitamin D is going to help us? Vitamin D does to have some sort of how do vitamin D is formed in our body. So vitamin D is we all there are various areas from skin. What are the important areas? Skin, intestine, and we have liver and kidney. From skin using ultraviolet rays. Ultraviolet B rays they have capabilities of helping us form a vitamin D. From intestine, this is observed. From different supplements are there. We get nourishment. We get different components, especially vitamin D from a seafood. Then we have a liver, where this is converted to hydroxylation is there. 25 hydroxy vitamin D, and this 25 hydroxy vitamin D is further converted to 1,2,5 dioxy vitamin D in kidneys, which is an active form of vitamin D. So this is how in a nutshell, we know how vitamin D is utilized by our body and how this active form is formed in ourselves. So when we taken something, and this is like, and after taking vitamin D, this vitamin D is absorbed and active form is formed. And what this vitamin D is going to help us. Vitamin D deficiency can lead to so many problems. Vitamin D deficiency can lead to hypertension. This can lead to metabolic syndrome. This can lead to obesity, insulin resistance, dyslipidemia, and diabetes. How? Is it like a vice versa, or is it like a one-sided story? For diabetes, insulin resistance, and metabolic syndrome is a vice versa story. If somebody is in metabolic syndrome, there are more chances of vitamin D deficiency. How and how this happens? मैकेनिज्म क्या है, इसके बारे में भी हम अभी थोड़ी देर में स्टडी करने वाले हैं. सो विटामिन डी एंड डायबिटीज. विटामिन डी डायबिटीज से कैसे लिंक्ड है? Vitamin D acts as one of the very important driving factor for the development of diabetes. This vitamin D deficiency lead to increased glucose intolerance, diabetes. How? This causes increase in insulin resistance, decrease in beta cell function, glucose intolerance, and ultimately diabetes. How does this happen? Everything. How this vitamin D deficiency can lead to autoimmune formation of diabetes or increase in incidence of diabetes. There is so many things. There are like environmental factors. There are epigenetic factors. There is autoimmune destruction of pancreatic beta cells. Impaired insulin sensitivity and glucose metabolism is associated with development of diabetes. We all know it. So vitamin D aggravates all these parameters and ultimately leads to development of metabolic syndrome and insulin resistance and diabetes. There is a beta cell dysfunction. There is decrease in insulin sensitivity. There is a dysfunction at a mitochondrial level. And ultimately, we have a development of diabetes and metabolic syndrome together. So all these things can, they do increases not only the risk of diabetes, but also dyslipidemias being a part of metabolic syndrome. Also increases the risk of cardiovascular illnesses. Again, consequences of metabolic syndrome. So vitamin D deficiency is not that only limited to musculoskeletal system. So we have so many aspects of vitamin D deficiency which can affect us in a larger way, in a serious way. So vitamin D supplementation, if we give vitamin D in diabetes, can we cure diabetes? Probably this is too much of a statement right now to say that we can cure diabetes by giving vitamin D. But vitamin D, if we give to our diabetic patient, there is definitely better control of diabetes. And the reason is obvious. There is improvement in insulin sensitivity. There is a decrease in insulin resistance. There is preservation of more beta cell mass also. So many aspects are there. Ultimately, there is an improvement in diabetic status. So for how long we can give and how much is to be given for this in diabetic patient? This we have discussed in the last episode. At least 12 weeks of vitamin D supplementation in a weekly dose, 60,000 units, weekly dose is good. Then we can give vitamin D on a monthly basis, 60,000 units monthly for at least 1 year. That has shown in studies to improve fasting blood glucose, postprandial blood glucose, and HbA1c levels. So this is in a nutshell about diabetes. So what else can be done? What are the cardiovascular effects of vitamin D activation? We have discussed diabetes, but then there is something else also is going on. If we have vitamin D receptor activation is there, ultimately vitamin D, does it affect anything else? It affects parathyroid hormone, diabetes, lipid metabolism, kidney problems, hypertension, and it has anti-inflammatory and antioxidative effects also. So we have anti-hypertrophic effect. And how does this anti-hypertrophic effect is manifest? It is manifest. It acts by reducing the expression of RCAN. Ultimately, This calcipressin one is reduced and ultimately lead to anti-hypertrophic effects. The regulation of extracellular matrix turnover by modulating the expression of matrix, metalloproteinases, and tissue inhibition of metalloproteinases. All these factors lead to anti-hypertrophic effects. So all these factors ultimately have a different effects of what we see is anti-proliferative effects, we have diabetogenic effects or diabetes preventive effects. We have a different type of cardiovascular effects of vitamin D, and all these factors. This again have a RAS inhibition is also there in a vitamin D activation. So anti-hypertensive effect, anti-hypertensive effect we can see. So diabetes, not only diabetes, uh, prevention, we can have like control of hypertension, we can have anti-hyperproliferative effects on the heart, we can have a vascular effects, and because of VEGF activation. So there are so many effects of vitamin D supplementation and its obviously its deficiencies. So all these effects can lead to different types of illnesses, and different like we can prevent so many things by giving vitamin D. Vitamin D and hypertension is, we know that we have seen there is a RAS activation. So if we have a RAS inhibition by giving vitamin D, we can have a better control of blood pressure. So definitely we have next ultraviolet B rays are there in the skin. They form vitamin D, 70 hydroxyvitamin D. Then we have a 25 hydroxyvitamin D formation in the liver. Then we have a 1 to 5 dihydroxyvitamin D. And all these active form of vitamin D, they have a RAS inhibition, and vitamin D level in they modulate blood pressure indirectly and directly also. And this kind of vitamin D supplementation, this is the kind of effect of vitamin D on blood pressure, is like a very like less noticed kind of effect. There are studies which says there is a vitamin D supplementation can help in prevention of diabetes. The vitamin D supplementation can help in management of hypertension also. So vitamin D supplementation is such an innocuous thing. Very simple, very easy to get, not very costly, and even the test is also not very costly. Things can be checked, things can be done, and can be supplemented. Again, the role of vitamin D in heart failure. Vitamin D deficiency has been linked with heart failure. Very low levels are associated with more negative health outcomes. So, if we consider the high mortality and huge burden of heart failure, if we can supplement our patients with vitamin D, this can be very important potential treatment tool, at least an adjuvant in treatment. So, vitamin D supplementation can help us in managing heart failure also. Vitamin D and coronary artery disease. Vitamin D deficiency is significantly associated with severity of coronary artery disease. We have seen in the very messy slide. There is a role of vitamin D in vascular cells using VGEF. They have shown that vitamin D deficiency this attenuates CAD by downregulating NF kappa beta pathways. So this all lead to increase in incidence of CADs. So vitamin D deficiency can lead to not only blood pressure, diabetes, but also coronary artery disease. Vitamin D do have some relation with the pain pathways. There are VDR expressing sites are skin, dorsal root ganglia, spinal cord, brain, and intestine. So we have some modulation of pain perception and its channels with which have an effect on vitamin D have effect on it. So vitamin D can help us in alleviating this pain perceptions also. So vitamin D is so important. Now we can see there are so many aspects where vitamin D is useful. statin-induced myalgia. Vitamin D deficiencies, we all know that patients who are on statins have a very severe, sometimes have a very severe myalgias. And if somebody is deficient in vitamin D, this can lead to actually very severe cramps in legs. So all these things can very well be managed with the help of vitamin D. Low serum vitamin D levels can lead to myositis, myopathy, myonecrosis. And if we supplement them with vitamin D, they have a definite improvement in all these symptoms, clinically and biochemically. So vitamin D supplementation improves quality of life. Patient feels happy. They feel more energetic. They have less pain. So everything they have definitely effect on the quality of life. So their quality of life definitely improves. Vitamin D is also vital to bone health. This is very well known fact. Vitamin D deficiencies can lead to rickets and osteomalacia, osteoporosis, and this is where our friends, orthopedician friends, do take advantage of using this very cheap drug in managing their patients. And we all know in pregnancy there is a lots of requirement of for vitamin D in lactation, in old age, in athletes. There is a lots of requirement of this calcium, vitamin D. So if we have a vitamin D supplementation, we have a definite improvement in bone parameters. So, sir, now regarding the use of vitamin D in management of uh, acute rise in BP, do we have something uh, to like some studies or something where we could find that somebody is coming to us with a new onset high blood pressure? Can we relate it somehow to vitamin D deficiencies, or this can be like this is, should be one of the tests which should be done in any hypertensive patient coming to me or any diabetic patient coming to me straightway for the first time?
In general, before we move on to pharmacology, pharmacological optimization of any disease, it would make sense to focus on lifestyle and nutritional optimization as well. That would be a general rule. And usually you cannot find a binary relationship or a direct relationship between, let us say, vitamin D deficiency and heart failure, or vitamin D deficiency and blood pressure. It's more of entanglement, more of a quantum kind of a relationship. So multiple things playing with each other. And if we understand this, then lifestyle optimization, nutritional optimization become number one. From a blood pressure point of view, we are aware of the impact of folic acid deficiency, vitamin B12 deficiency on hyperhomocystinemia, and then the effect of homocysteine on vascular health. So I think vitamin D would come in that family as well. The same kind of impact might be there. We have multiple questions. Dr. Suneet, thank you so much for your talk. And one question is heart failure. The chief symptom of heart failure is easy fatigability. The chief symptom of vitamin D deficiency is easy fatigability. So, how do you tease out a history? Patient comes to you with easy fatigability. How do you realize whether it is because of heart failure or it is because of something else?
Sir, heart failure patient whosoever is coming to us is in a diabetic clinic is practically by definition is having at least say heart failure. So to clinically differentiate between a clinically significant heart failure and a vitamin D deficiency fatigue, so there are so many other parameters we can think. Patient will give more of a complaints of a crampy pain in legs rather than uh, like a heart failure kind of history. Failure kind of history, we have to think other. We have to take other history also. So if patient is giving history of like dyspnea on exertion, it's definitely giving history of dyspnea on exertion. So we can think of going towards more towards heart failure kind of symptoms. If patient is giving history of fatigue, only easy fatiguability, leg cramps are there, नस पे नस चढ़ जाती है डॉक्टर साहब मेरी हमेशा. So these are more of a vitamin D or nutritional kind of symptoms.
More questions from Dr. Hetal and Dr. Ravinder. We have this question. What is the best time for a sun bath or to soak in the sun?
This
Now,
is
yeah, now actually it
both
is
both
11
both.
a.m. to 2 p.m.
Yeah, this is an extremely odd time and extremely serious kind of thing, especially in the summers. Nobody can dare to be in sun to actually make vitamin D, and that too in a Goa kind of breeze. So only our laborers who are working day in the day during the day. So with mostly bare skin, they have a sufficient exposure to make vitamin D, and otherwise it is actually difficult to make vitamin D with our kind of lifestyle, where we hardly have any exposure of UV rays during those peak hours, 11 a.m. to 2 p.m. or 3 p.m.
The ultraviolet B rays are maximal at around 12 noon. That is one reason. And then in the skin also, there are enzymes which convert that sunlight into vitamin D. They are most effective during the afternoon. And this diurnal variation we are aware of in each and every system of endocrinology. So it is actually tough. I am reminded of the story, Dr. Suneet, the man with the shirt, the happy man with the happy shirt. So actually, what you said is if you're not wearing a shirt, then you are happy because then you have vitamin D. But socially, that is not acceptable and it's not possible for most of us. Another question from Dr. Pratik is vegetarian sources of vitamin D. So vitamin D is usually an animal product, and if it is fortified, if any vegetarian food is fortified, that's separate. Dalda ghee is one example, but then there are other side effects to it, and the level of fortification is not all that high. How does it work for you, Dr. Sunit, in terms of milk? Is milk a good source of calcium? Is milk a good source of vitamin D? And if not, is milk a good source of fat, which will help us in absorbing vitamin D?
So milk is definitely a good source of calcium, won't say vitamin D, but and definitely full cream milk is anything which is having fat in it because it's a fat soluble vitamin. That's why we say take vitamin D after meal. Our food is usually rich in fat. It's not, never a fat-free kind of diet in Indian setting. So this helps in absorption of vitamin D. So vitamin D is usually from a non-veg source, especially seafood. So seafood is definitely rich in vitamin D.
There are many people who say that milk is bad for health. What is your take on that?
Sir, definitely, yes, it's not a wrong statement, but we need to understand that if we take fat, fat is not that bad. If you look at a balanced diet is again 50-60% of energy from carbohydrates, 30% from fat, and 20% from protein. So, fat is not bad. But if we take 50% of diet so calories from fat and we don't do any physical activity, then it's definitely very bad. So if we are doing some sort of physical activities, if we are able to like utilize that fat rather than letting it deposit, the extra calories to get deposited, then definitely this fat is good and milk fat is good.
Milk is also a source of class A proteins. So it's just milk and eggs that you have. And if your patient is vegetarian, then milk is the best option actually for taking for getting calcium and also for getting proteins. Dr. Verma, many more questions. Dr. Agnik says, could you please repeat the importance of vitamin D administration in pre-diabetes, in diabetes type 1, type 2?
So the slides were like very self-explanatory, but the things are they were having so much of information, and I was finding it very difficult to finish it up in 15-20 minutes and to leave the whole time for discussion. So, Dr. Saab, everything was there inside, but to summarize, we say the use of vitamin D in pre-diabetes and diabetes. Pre-diabetes and diabetes, they are inflammatory disorders. Now we know it. Inflammation has a very major role in onset of diabetes. As an anti-inflammatory agent, vitamin D has a very good role. And as that's there are many aspects of insulin secretion, insulin sensitization, beta cell protection, where vitamin D has a role. So vitamin D, if somebody is deficient in vitamin D, which by default in people living in North India, because they don't have a more exposure to vitamin D rich food. Fortification of food is not there, and they are not exposed to sunlight that much, and that's why they are mostly deficient. For those people, if we start giving vitamin D, even blindly, if you are not able to check it, then there is no harm. And this has shown there is a better control of blood glucose level with vitamin D supplementation.
So vitamin D actually does help, and vitamin D deficiency is ubiquitous across the country. Actually, northeast, southwest, the data is the same from across the country. And though we are blessed with sunlight, we are a heliophobic nation. Heliophobic means we tend to run away from the sun. We tend to avoid it. The slides were excellent, actually, Dr. Suneet. So a great description of physiology and also a great description of pathophysiology. But coming to pharmacology now, Dr. Lalchand says, I had a patient of ejection fraction less than 25%. Vitamin D 60,000 tablets were given, but now the patient went into decompensated heart failure. Can this be because of vitamin D or in spite of vitamin D?
So, doesn't look like because of vitamin D. One reason can be if patient was taking but 60,000 tablets, they were not sachet, which he has taken with lots of milk.
Water.
So there is no way that he has somehow overloaded with some fluid. Only thing which I can see is if somebody is taking lots of milk to dissolve that sachet. Now we have tablets, now we have capsules, now we have liquids, which usually don't need to be dissolved in milk or liquid for intake. So other than fluid, or other than per se cardiac compromise, I don't find any role of vitamin D in decompensating it. There may be another thing. There may be some infection undergoing. There may be underlying some renal problem, which can lead to again decrease in loss of water from the kidneys and leading to fluid overload and ultimately leading to decompensation. For maybe new onset MI, if patient is diabetic and is having a low ejection fraction, some more compromise of some microvasculature in coronaries ultimately can lead to further decrease in ejection fraction, and again compromise that can increase the chances of heart failure. But vitamin D supplementation per se should not lead to should not be the cause of this decompensation.
But Dr. Chand's question is valid. Dr. Chand, let us look at it from a very simplistic perspective. Why is it that a heart failure patient will decompensate? Uh, First of all, lifestyle and nutritional aspects. Maybe sudden onset anemia for whatever reason. Aspirin itself can cause anemia. Aspirin is something that we'll keep on prescribing. Second is too much salt or too much fluid intake. And this would be very common in winter months. Third would also be protein deficiency. In fact, if you are looking at a patient with idiopathic edema, then two nutritional factors to rule out is one is too much of salt and the other one is too little of protein. Just like you read about kwashiorkor in the textbooks, adult kwashiorkor, subclinical kwashiorkor is quite common in our OPDs, even in the richer states of the country. It's because our patients don't have enough protein, so there's not enough fluid binding capacity. So this would be related to nutrition. Related to lifestyle would be lack of physical conditioning. The patient stopped exercising, maybe just out of laziness, or perhaps because he had developed a dengue or chikungunya or a viral fever, and then the patient is not able to come back to normal. So these would be the non-medical kind of things. And in medical, like Dr. Sunita said, a respiratory infection, a cardiac insult, a renal insult, and acute kidney injury, all these can precipitate. I'd just like to add endocrine as well, and uncontrolled Graves' disease, uncontrolled Hashimoto's thyroiditis, uncontrolled diabetes. All these two might have caused that sudden worsening of heart failure in this patient. One more question coming from Dr. Pooja. This is should a healthy person take vitamin D maybe once a month as a preventive measure for cardiovascular issues, in assuming that there is no deficiency?
So maintenance dose of vitamin D is 60,000 units once a month. This can have like so many benefits. If we don't take vitamin D supplementation once a month, there is going to be a definite deficiency. especially in our setting, who are not taking seafood, who are not taking food rich in vitamin D. So, uh, Dr. Pooja very rightly said, if we take vitamin D supplementation once a month, this can have different kind of benefits, including cardiovascular health. And as we discussed while presenting slides, there are definite benefits of vitamin D supplementation on cardiovascular health. So cardiovascular health will be have all sort of positive effect, be it a diabetes related, maybe control of diabetes, be a RAS system related. So be it a direct prevention of some effects on cardiac walls and the proliferative effects of vitamin D. So all these benefits are definitely useful, and they are going to help a patient if they take vitamin D supplement, be it a prophylactic supplement. Just we need to just avoid overdosing. That is also very important, because vitamin D overdosing is not good.
You've mentioned, Dr. Suneet, once a month for asymptomatic healthy individuals. How about those who are symptomatic or those who have diagnosed or evaluated vitamin D deficiency? Maybe the level is 15 nanogram per ml. So, what would be the dose for them?
Set for them is a once a week, 60,000 units once a week for 12 weeks. That is the dose for therapeutic dose, and followed by once a month. That is to be continued, and that will take care of further deficiencies of vitamin D.
There are many patients who come in and they complain of myalgia, general aches and pains. For example, somebody on statin. So, what is more common? A person who is on statins and who is complaining of generalized aches and pains. What is more common? Would it be statin induced myopathy or would it be just vitamin D deficiency? And then, how do we manage such a patient?
Sir, in clinical practice, the what we see is more of a vitamin D related problems rather than a statin induced myalgias. The dose of statins which we usually prescribe is 10 milligram of rosuvastatin or 20 milligram of atorvastatin. Usually, patients do not have myalgias with this dose. If we give 20 milligram of rosuvastatin or 40 milligram or more of atorvastatin, then they have a chances of having more myalgias because of statin-induced myopathies. In general, if patient is coming to us with this kind of symptoms, either he is or she is not on statin, or they are on statin with low dose or moderate intensity statins. Rosuvastatin 10 milligram is moderate intensity statin dose. With this dose, if patient is complaining, probably we are dealing with vitamin D deficiency and vitamin D associated symptoms. What we can do is we can go for CK-NAC or CK-MM kind of test, where we can find out if we are dealing with some sort of increase in enzymes because of myopathies. If we have increase in enzymes because of myopathies, then probably statins to be blamed.
Question that is coming, let me take this. What is the link between myalgia and vitamin D? So, vitamin D actually helps in skeletal health, nerve health, and also muscle health. And in vitamin D deficiency, what happens is the proximal muscles become weak. So, you have myopathy, which means that the muscles are weak. Eh, You don't have enough power. Myalgia would mean pain. And actually, in vitamin D deficiency, there are two types of pains. There is a muscle pain because you're having to work, you're having to use the muscles, and the muscles are not up to the mark. There is also bone pain or bone tenderness. So, actually, one of the ways of diagnosing severe vitamin D deficiency is to look for bone tenderness over the lower rib cage or just above the ankle. Towards the lower end of the tibia. And these are well defined and validated signs actually. You just palpate, press, look for tenderness at the lower end of the tibia or at the lower rib cage. And if you have pain, then you can assume it's vitamin D deficiency. Of course, there would be many other differentials as well, but we should be aware of that. One other symptom that we see in our OPD, and people tend to, so we'd like Dr. Suneet's opinion on this. We have a few minutes more to go. There is something known in rheumatology as the occiput wall distance. So now the occiput wall distance should be zero, right? You should be able to touch the wall with the occiput of your head. Occiput wall distance cannot be made zero in a disease like ankylosing spondylitis. But the vast majority of people who come to our OPD with an occiput wall distance more than zero, they don't have ankylosing spondylitis. They may have osteoporosis and an associated fracture or collapse of the cervical vertebra. They may not even have that. They just may have a cervical spasm, a muscle spasm of the neck. And one of the common reasons for this is vitamin D deficiency. It's malnutrition, it's malposture, wrong posture. So, how frequently do you see this, Dr. Suneet? And then what do you counsel your patients to do?
Sir, vitamin D related symptoms, deficiency related symptoms are very, very common in OPDs, especially the patients who are coming with non-specific myalgias. And the patient coming with non-specific myalgias number is huge. Everywhere pain. Where does it pain? Is it like tummy is hurting or headache is there? No, it's pain is everywhere. It's not visceral pain. We can make out from history. It's a like we are having pain in the muscles. We are having pain in the bones, not in joints. So non-specific myalgias. I'm not talking about arthritis as of now. Non-specific myalgias is one of the very common symptoms when we sit in general medicine OPD. Patient may be diabetic, non-diabetic, cardiac issues. Patient may be hypertensive, maybe renal issues, CKD patients. All all sorts of illness, chronic illnesses, or maybe healthy otherwise, not a known case of any chronic illness. They still have these kind of symptoms. So, patients who is coming to us with a wrong posture, especially patients, people who are working on computers for long, IT professionals, bank managers, bank desk people who keep on sitting, who don't even try to stretch themselves, they have a wrong posture. And for them, this test is actually always positive. They always have some sort of stiffness. They have everything because of wrong postures, spine problems, and they have osteoporosis. In those patients, if we supplement with them vitamin D and tell them correct posture, if we tell them stretching, the importance of daily exercise, their life actually improves. Their symptoms are gone. They feel good. So this is a pretty common symptom.
So, just simple interventions talking about posture, lifestyle, and also vitamin D. We have this question that since there are many studies that have talked about the role of vitamin D supplementation, what dose would you suggest in management of type 2 diabetes or pre-diabetes or heart disease? So, very simple and easy doses. If there is confirmed deficiency or the patient is symptomatic in terms of musculoskeletal symptoms, the way Dr. Suneet has just described, we also call it the MOAN syndrome, MOAN, musculo, arthro, neuropathic, any kind of pain. So if the patient is symptomatic or has a confirmed deficiency, then 60,000 units, a gel capsule, once a week for up to 3 months, and then you can make it once a fortnight or once a month. For maintenance, once a fortnight or once a month. If you have a person who is obese or overweight, then maybe higher doses would be required. Even for maintenance, you would require once in 15 days because this vitamin D tends to get sequestered in the adipose tissue and less of it is available for use in circulation. This same thing would be true for pre-diabetes and diabetes, and the same dosage would be true for cardiovascular conditions. And if you take a history, like Dr. Suneet has mentioned so many symptoms, if you take an empathic history, just spend a few minutes, you will actually find that lots and lots of your patients will come in with complaints of vitamin D deficiency. In medical college, we were asked a very straightforward method. We were taught a very straightforward method of taking a history. Can you use an Indian style toilet or not? Now, many people don't have it. And that's not a very pleasant question to ask, also, if you're meeting a patient for the first time. Now, why don't we ask a question like when you go to the Gurdwara Sahib or to the temple, the mandir, or maybe to the mosque to pay obeisance, are you able to manage or not? When you have to bow down for the arti or for the namaz, how easy is it for you to sit down? And then, okay, you're able to sit down without support. How easy for it is to for easy is it for you to stand up? So these are questions. Suddenly, that religious or spiritual dimension also comes in, and then the patient will say, "Yes, I have had this problem for years and years. A Sikh lady will tell you that I feel so ashamed I have not been able to go to the Gurdwara Sahib for the past 4 years because I feel so ashamed I cannot bow down, I cannot sit on the floor. And then the answer to this is, of course, it can be osteoarthritis, it can be other things, but the simplest answer is vitamin D supplementation. That same thing, once a week for 12 weeks, and now, madam, let's go to the Gurdwara or to the temple. So, if you are able to take a history in an empathic manner, in a person centered manner, you will be able to pick up more and more cases of vitamin D deficiency and you will be able to help them much better. So, Dr. Suneet, we've had a great time with you. Uh, when we began, we were speaking about vitamin D and musculoskeletal issues, vitamin D and metabolic, you've spoken about that. We were also speaking about vitamin D and mitogenic, vitamin D and miasma, that is infection. And we wanted to speak about vitamin D and mood disorders. So actually, for many of these things, if we are able to keep a vitamin D around 50 nanogram per ml, 40 to 60 nanogram per ml, we will be able to improve the quality of life of our patients. And even in cardiometabolic conditions, if you're able to keep your vitamin D right in the middle, in that Goldilocks zone between 40 and 60, you will have better response of the vasculature, better response of the smooth muscle, the cardiac muscle, and also the skeletal muscle. And if you have better quality skeletal muscle, you get better physical conditioning, and that also helps in improving cardiometabolic health. But there was one question we wanted to ask you, Dr. Verma, based upon your expertise. Vitamin D and miasma. Miasma means ill health, infection. So, so many patients now coming in with the chikungunya, dengue. What can we do before the chikungunya occurs to prevent it or to reduce the severity? What can we do during the chikungunya or dengue or acute viral illness or exacerbation of asthma or COPD? And what can we do after that to improve our health?
Sir, in the past 2-3 years, we have seen a plethora of viral attacks. So many serious kind of viruses and different kind of viruses, debilitating kind of viruses attacks. Even the common cold kind of virus, which we usually used to see this time and in this season, in the past 3 months, is causing lots of trouble. It's not going, cough is not going, myalgias are not going, patients are feeling lazy, lethargic for prolonged time, not for 7 days, maybe for 2 weeks, 3 weeks, 4 weeks. So, very important thing is general health before, during, and after. Before we contract an infection, we know we are in a uh, in our country or anywhere, we can get any kind of viral infection, any kind of bacterial infection. If your health is okay, if you have an optimal intake of fluids, if you have an optimal intake of nutrients, if you have an optimal intake of even vitamins, for that matter, vitamin D, our health is good, our immune system is good. If we have an optimal intake of protein, we are able to fight infections better. So we can have prevention of those kind of infections, or we can have infection, but that may not affect us much more. So this is how we can prevent or attenuate the effects of these kind of infections. Once we are infected, then rest during active phase of infection. It's not advisable to work. It's actually one should take rest because 1 or 2 days of rest is going to help them recover better and early. Then proper intake of fluids, proper intake of diet and medications if needed. And if somebody is deficient in vitamin D, even the supplementation of vitamin D helps them a lot. And this helps them at least going away of those muscular symptoms, those fatigue symptoms. And internally, it helps in fighting against those infections at immune level. So, prevention and cure, both. We have right diet, right fluid intake, and proper supplementations of vitamins and minerals. Yes.
So the basic answer we are getting from Dr. Suneet is common sense. But considering the burden of fever and ill health that we see in our clinics, it means common sense is a bit in short supply. All we need to do is to follow the right diet and exercise pattern, the right lifestyle, and we will be able to reduce the impact of many of these unwanted illnesses. Just like common sense sometimes seems to be in short supply, vitamin D is also in short supply in our diet and in our lifestyle, and therefore we need to supplement. This question from Dr. Anil, let me take. In pregnancy, yes, vitamin D is important. It is important for the mother as well as for the fetus. And in fact, a lot of good quality research from across India shows that neonatal vitamin D deficiency is rampant. In first trimester, we should avoid giving pharmacological supplements, but in second and third trimester, you will follow the standard supplements. You can give something like 2000 units every day. That is also doable. And if you wish, if the patient has got deficiency, then 60,000 units once a week is also fine, equally safe. If you want to just be on the safer side, there is no deficiency, you just want to keep levels normal, then 60,000 units once a week, once a month again would be fine in pregnancy. Do note that milk, breast milk, cow milk is a very, very poor source of vitamin D, just 25 to 50 units per liter and per 100 ml, sorry. And it's calcium that is there in vitamin D in the milk. But if you have lots of calcium and there is no vitamin D, then the calcium is not going to be absorbed from the GIT also. So along with the milk, you do need to give vitamin D separately. Dr. Suneet, it's been great having you with us. All these questions that you've been able to handle, these have certainly acted like a cardiometabolic booster for us.
Thank you,
So
sir.
we began, Dr. Suneet, by asking you about battery charge Rendiye 24 Ghante from Chandigarh. Now, last question before we part. Chandigarh Kare Ashki. What does this mean?
चंडीगढ़ आज की करता है सर.
Yeah, in English. That's the point. What does it mean?
Will tell you.
Okay, so Chandigarh is a very nice place to be in, and we'd like to thank Dr. Suneet for having represented the Tri City so well on today's show. Uh, the translation of Chandigarh Kare Ashki, let's keep for the next time when we have Dr. Suneet with us again. In the meantime, from my side, it's been great being with you, interacting with you. This was the second in our series of vitamin D talks. We'll be having two more talks at fortnightly intervals. I look forward to meeting you again, being with you again. In the next two talks, we'll focus on orthopedics, that's musculoskeletal health, and also on gynae, on women's health. And we'll be able to answer some of the questions that Dr. Anil had asked in greater detail during those during those talk shows. I'd like to thank you, Dr. Suneet, once again, and I'd like to hand over to team IJCP for the closing comments, please.
Thank you, sir.
We have Pratik with us. Yeah.
And thank you, Dr. Suneet. Thank you, Dr. Sanjay, for a very great session. And we've had a very good viewership also today again to listen to stalwarts from endocrinology. And on the topic, Anup, would you like to add to this?
No, I really want to thank speaker Dr. Suneet Verma and obviously our mentor and guide Dr. Sanjay Kalra for taking this fantastic session on role of vitamin D in cardiometabolic disorders. Really an eye opener at many fronts, and I'm sure audience would have loved the whole session. Thanks a lot, sir. Thank you so much.
Thank
Thank
you,
you, sir.
and thank you, Dr. Suneet.
Thank you, sir. Thank you.